Hello there. Thank you for being here today. I'm Dr. Perkins, a board-certified OBGYN, and today we're talking about antibiotics for bacterial vaginosis. If you're here, this is probably because you have an infection, you think you might have an infection, you're questioning whether or not you have an infection. There's some concern there. This video will simply be talking about the treatment options as far as antibiotics are concerned. Bacterial vaginosis, or BV for short, is one of the most common causes of abnormal vaginal discharge. The internet is filled with so much misinformation. And so I find that people are constantly asking me, well, how do we truly treat this? What do I need to do to make things better? And so I'm here to give you that information and to help. Let's dive into it. Let's first talk about what bacterial vaginosis is. It is an infection of the vaginal space. It is caused by an overgrowth of anaerobic bacteria that normally lives there. Bacterial vaginosis is not an STD. So this is not a bacteria that you got from a partner or from using toys incorrectly or even from sitting on the toilet without covering it, like the toilet seat. I've heard so many different things, but it is not an STD. However, we do know that it is heavily and closely linked with sexual activity. And I'll explain why. The vagina loves to be acidic. When we think of the pH scale, the vagina loves to be somewhere around 3.5 to 4.5. That is the sweet spot. It loves to be acidic. When we think of semen and sexual activity, semen is on the opposite side. Semen is more basic. It's more alkaline. And so think about this. If we have unprotected sexual intercourse and we have an acidic space that is being introduced by an alkaline substance, things actually neutralize. And so what happens post-sexual intercourse is that the acidic state of the vagina is decreased and it's not acidic anymore. And during that transition, if this change in the pH continues for a long period of time, meaning more than a few minutes, what happens is that your body will try to increase the amount of lactobacillus that is present in the vagina. Now, what is that? Lactobacillus is a bacteria that produces acid. It helps to maintain the microbiome. It helps to make sure that the vagina is very acidic. And so your body's like, well, we need more acid. Let's produce more bacteria that will lead to more acid. It's a wonderful strategy, but it also leads to an overgrowth of other bacteria. It also increases the likelihood of getting like an STD because the things that helps to protect us from harmful bacteria is just not really quite there anymore because we're focused on trying to get more acid. And so what happens over time is that bacterial vaginosis can develop, and we may notice a fishy odor. We may notice an increase in discharge, more grayish discharge. So much can happen during that time frame. So the first line treatment for bacterial vaginosis is antibiotics. The most common and the most well-supported with the most evidence, scientific evidence to support effective treatment is metronidazole. This is often given as a pill, 500 milligrams, and you take this twice a day for 7 days. That is the typical treatment. It is highly effective. We know that while you're getting treatment with this, that you want to avoid alcohol because it can make you feel really sick if you drink alcohol while you're getting treatment. It is also available as a gel called MetroGel. I must mention also that metronidazole can sometimes be called Flagyl. So both names are the same. MetroGel actually goes vaginally. So you insert it with a tube and it goes into the vagina for your treatment. The treatment with that gel is for 5 days. And as far as it being effective, it's just as effective. When I think of treatments between the pill and the gel, I often think about it as the pill goes throughout your entire system. The gel goes right to the vagina. And so if you're comfortable with placing things in the vagina, I personally think let's place the medicine where it needs to work so that you have less systemic effects. Sometimes you can have like GI upset, a tummy issue, taking it by mouth. And so the MetroGel is just a great option. There's also clindamycin, which is given as a cream that also helps with this treatment. Now, it's not the primary treatment. Most people receive the Flagyl or the metronidazole, but it works if you have any allergies to metronidazole or you've had like a reaction before that is unpleasant. It is just another alternative. Another alternative is using clindamycin by pills or orally, as well as tinidazole as another alternative treatment. Both of these are much better tolerated compared to the Flagyl or the metronidazole, but it's just not as effective. And so this is why it's more of an alternative treatment option as opposed to the primary treatment option. What do antibiotics do or don't do when it comes to bacterial vaginosis? We know that they reduce anaerobic overgrowth, which is what is needed. We know that this leads to resolving the discharge or any fishy odor that you have. We know that they will restore your vaginal pH so that it's nice and acidic like your vagina likes to be. We know that they do not prevent recurrence. So you can get a treatment and the treatment will clear the infection at that moment in time. In a month, yes, you can have bacterial vaginosis again. In 2 months, in 3 months, in a year. So it doesn't create protection long term. It just clears the infection when you have it and when you take the treatment. If you have an underlying microbiome imbalance, it doesn't correct for that, and it doesn't treat yeast infections. In fact, what we find is that following treatment with metronidazole or any of the antibiotics, there's actually an increased chance of getting a yeast infection afterwards. A part of the reason for that is that the yeast can overgrow while we're trying to get rid of this extra bacteria that exists. And so because of that, I often will offer a yeast infection treatment to follow BV antibiotics for that same reason, because I know a majority of the time I'm going to get another call that Dr. Perkins, I now have a yeast infection and I need help. So because of that, I would suggest talking to your provider at the same time as you're getting your treatment for bacterial vaginosis to prepare for this possible effect after taking these antibiotics. Now, it's important for us to also talk about how to decrease recurrence. In general, we know that the risk of getting bacterial vaginosis increases with a new partner, if you have multiple partners, if you're douching, if you're not using condoms. And so if you find that you keep getting this infection, it is probably a good idea for us to consider other ways for us to decrease the likelihood of it developing again. Yes, using condoms will help because we're decreasing this alkaline semen from touching and being intermingled with our vaginal space. We may want to consider taking probiotics just to help our good bacteria in the vagina, but we also may want to consider using boric acid. Now, I've talked about boric acid quite a bit on my channel in other videos, but boric acid helps us to maintain the acidity in our vagina, and sometimes that may also be helpful before the infection happens. So for instance, I've helped my patients with this issue, if it is stimulated by sexual activity, by just using some boric acid after sex. Sometimes it may happen in cases where we're not sexually active, but maybe our periods may increase the likelihood of getting that. Yes, period blood is more alkaline than the vagina. And so if we have long periods, if we are having heavy periods, if we are just having a regular menstrual cycle, sometimes we may have this infection develop because blood mixed in our vaginal space, and we're sensitive to that small change in our pH, and BV develops. And so if that's happening, boric acid may also be helpful after your periods. Now, if you're considering all of these things, I really, truly want you to talk to your doctor about using this as a possibility before attempting it on your own. We've covered all of the antibiotics that are used for bacterial vaginosis, so I hope this is helpful for you. If you have any trouble with the spelling or the dosage, or you want to clarify, comment below. I'd also like to offer a copy of my ebook to you today, because one, you were listening, but two, because our vaginas respond very much so to our hormones. It's who we are. It's what makes us whole. We are hormonal beings. And I know that it's challenging trying to navigate this world hormonally. And so I want to help you with that. And so this ebook is a good start to helping you create balance in your vagina and in your life. So if you'd like a copy of this, please click the link below and I'll send it your way. Thank you so much for listening in. And I hope that we've learned a little bit today. I'll see you next time.